5th December, the day that doctors working in the massive public sector countrywide will down their tools. This, according to them, means that they will not attend to any patients who visit hospitals and healthcare centers, whether for a simple checkup or a life-threatening emergency. The threatened strike, which comes a year after a protest in Nairobi, is already getting support from nurses.
So we are advising, don't go because you might waste a lot of time going to the hospital. Try to avoid situations which will make you sick. And for those who are in a situation where they must access healthcare on the 5th, like maybe those who are expecting to deliver or something, we are advising start keeping some money so that if our talks with the government fail, you will need to seek treatment maybe in the private hospitals.
As the clock ticks towards the D-Day, attempts to broker a deal to forestall the industrial action seems to be headed for a deadlock.
So we are saying we want to join hands with the Kenyan public so that we can ask the government to meet its obligation of making hospitals to be able to provide proper health care.
According to the union, many of the doctors complain that after paying 450,000 shillings annual tuition fees for between 5 to 7 years, they are hired on low entry-level salaries. On average, doctors earn between 50,000 to 60,000 shillings, which they say is just too little.
The highest specialist, who is specialist 1, spends 15 years in college and undergoing very rigorous training. And that alone necessitates that you have to be remunerated well. We have people in Kenya who are earning over 1 million shillings in government, and yet I don't think they are as qualified as doctors.
Even those who work odd or long hours are not compensated for overtime. On average, a doctor should work for 52 hours a week, but many say they work up until 172 hours, leading to accidents.
Doctors like our surgical colleagues, they actually experience some very difficult situations. They can start a surgery thinking that they're just going to pull out a small organ or maybe a small tissue. And then when they go in, they find that it is a very big complication. The patient is bleeding, they cannot stop it, and they end up spending even 10 hours in theater.
Under the bargaining agreement, the doctors' union is pressing for a 300% pay rise and recruitment of more doctors to ensure that the country attains the World Health Organization's doctor-to-patient ratio of 1 doctor for every 1,000 people. Currently, Kenya's ratio stands at 1 doctor for 40,000 people.
The nature of the strike is a total strike. There will be no emergencies being attended to in public hospitals. All patients will be referred to hospitals where there are doctors, private hospitals which pay their doctors, or even if they live near neighboring countries, they can go to neighboring countries.
While many may argue that the doctors' strike will be detrimental to the health sector, the doctors say that the strike is the hope of many in the field that things will change for the better, and the doctors' exodus from the public sector will reduce. Currently, there are only about 2,000 doctors countrywide, catering for a population of about 38 million. For KTN Prime, I'm Betty Kialo.